Hello everyone, guys. Today we will talk about menstrual disorder. Okay, what about menstrual disorder? Definition. It is a cyclical shedding of a functional endometrium and it has the following characteristics. Amount of flow 25 AT/ml, average 30 mL. Cycle length 21-35 days. Duration of flow 2-7 days. Healthy menstrual blood does not coagulate. It occurs in a cyclical manner and regularly. Here you see menstrual cycle. Each month during the years between puberty and menopause, a woman's body goes through a number of changes to get ready for possible pregnancy. Yes, this series of hormone-driven events is called the menstrual cycle. During each menstrual cycle, an egg develops and is released from the ovaries. The lining of the uterus builds up. If a pregnancy doesn't happen, the uterine lining sheds during a menstrual period. Then the cycle starts again. A woman's menstrual cycle is divided into follicular phases and luteal phases. Menstrual phases is the first stage of menstrual cycle. It's also when you get a period. This phase starts when egg from the previous cycle isn't fertilized. Because pregnancy hasn't taken place, levels of the hormones estrogen and progesterone drop. The thickening lining of uterus, which would support a pregnancy, is no longer needed, so it's shed through our vagina. During period, release a combination of blood, mucus, and tissue from uterus. You may have some symptoms like this: cramps, trazos, hemorrhoids, tender breasts, bloating, mood swings, irritability, headaches, tiredness, low back pain. On average, women are in menstrual phases cycle for 3-7 days. Some women have longer periods than others. Follicular phases. Yes, now we talk about first phases, follicular phases. Follicular phases start on the first day of a period and ends when you ovulate. It starts when the hypothalamus sends a signal to pituitary glands to release follicular stimulated hormones. These hormones stimulated ovaries to produce around 5 to 20 small sacs called follicles. Each follicle contains an immature egg. Only the healthiest egg will eventually mature. The rest of the follicles will be reabsorbed into body. The maturing follicle sets off a surge in estrogen that thickens the lining of uterus. This creates a nutrient-rich environment for an embryo to grow. Average follicular phases last for about 60 days. 60 days, it can range from 11 to 27 days depending on your cycle. Ovulation phase. Next phase is ovulation. Ovulation phases. Raising estrogen levels during the follicular phases trigger your pituitary gland to release luteinizing hormones. This is what starts the process of ovulation. Ovulation is when your ovary releases a mature egg. The egg travels down the fallopian tube towards the uterus to be fertilized by sperm. The ovulation phase is the only time during your menstrual cycle when you can get pregnant. You can tell that your ovulation by symptoms like this: a slight rise in basal body temperature, thicker discharge that has the texture of egg whites. Ovulation happens at around 14. Here you see 14 If you have a 28-day cycle, right in the middle of your menstrual cycle, it lasts about 24 hours. After a day, the egg will die or dissolve if isn't fertilized. Luteal phases. Second phase of all, luteal phases. After the follicle releases its egg, it changes into the corpus luteum. The structure releases hormones, mainly progesterone, and some estrogen. The rise in hormones keeps your uterine lining thick and ready for a fertilized egg to implant. If you do get pregnant, your body will produce human chorionic gonadotropin. This hormone pregnancy test detect. It helps maintain the corpus luteum and keeps the uterine lining thick. If you don't get pregnant, the corpus luteum will shrink away and be resorbed. This leads to decreased levels of estrogen and progesterone, which causes the onset of period. The uterine lining will shed during your period. During these phases, if you don't get pregnant, you may experience symptoms of premenstrual syndromes. These include bloating, breast swelling, pain or tenderness, mood change, headache, weight gain, change in sexual desire, food cravings, trouble sleeping. The luteal phases last for 11 to 70 days. The average length is 70 days. Every woman's menstrual cycle is different. Some women get their period at the same time each month. Others are more irregular. Some women bleed more heavy or for a longer number of days than others. Your menstrual cycle can also change during certain times of life. For example, it can get more irregular as you get close to menopause. Any of these things can alter your menstrual cycle. Birth control. The birth control pill may make your periods shorter and lighter, while on some pills you won't get a period at all. Okay, classification of menstrual cycle. We talked about menstrual cycle, classification of menstrual disorders, premenstrual syndrome. We talked about premenstrual syndrome, just abnormal bleeding, which include amenorrhea, oligomenorrhea, menorrhagia, dysmenorrhea, dysfunctional uterine bleeding, postmenopausal bleeding. Mm, Premenstrual syndrome occurs in at least three consecutive menstrual cycles. Symptoms must occur in the second half of the menstrual cycle. Luteal phases. There must be a symptom-free period of at least 7 days in the first half of the cycle. Symptoms must be severe enough to require medical advice or treatment. Edema, weight gain, restlessness, irritability, and increased tensions. Diagnosis. How we will diagnose this symptom? Mainly based on patient's history and patient's complaints. Yes, patient charts symptoms for at least 3 symptomatic cycle. Rule out medical conditions that mimic premenstrual syndromes, thyroid disease, and anemia. Management, conservative management. Diet, limit caffeine, alcohol, exclude caffeine, alcohol, tobacco, and chocolate intake. Eat small, frequent meals. Decrease sodium intake. Stress management, exclude stress, aerobic exercise, cognitive behavioral therapy. Drugs therapies, calcium carbonate, for bloating, pain, and food craving, magnesium for water return, vitamin group B6 and vitamin E, NSAIDs, yes, bromkriptine for mastalgia, menorrhagia. What about menorrhagia? It's synonyms hypermenorrhea, defined as excessive, heavy, or prolonged menstrual flow. Possible causes include submucous myomas, adenomyomas, intrauterine device, endometrial hyperplasia, malignant tumors. Defines as unusually light menstrual flow, sometimes on spotting. Possible causes include hymenal or cervical stenosis, uterine synetia, Asherman syndromes, occasionally oral contraceptives. Metrorrhagia, intermenstrual bleeding, defined as bleeding occurring at any time between the menstrual periods. Possible causes include endometrial polyps, cervix, endometrium, exogenous estrogen administration. Polymenorrhea describes periods that occur too frequently, usually associated with an ovulation and rarely with a shortened luteal phases in the menstrual cycle. Menometrorrhagia. This is bleeding that occurs at irregular intervals and varies in amount and the duration of bleeding, caused by any conditions that can lead to intermenstrual bleeding. Oligomenorrhea describes menstrual periods that occur more than 3 to 5 days apart. Possible causes anovulation, which may be from endocrine causes, pregnancy, menopause, pituitary and hypothalamic disorders, neoplasms, or systematic causes, excessive weight loss, estrogen secreting tumors. Amenorrhea. What means amenorrhea? Amenorrhea, absence of menstruation for 6 months in a woman who previously had a normal menstrual cycle. Please, learning. Absence of menstruation for 6 months in a woman who previously had a normal menstrual cycle. Absence of menstruation in girls under 16 years of age, primary amenorrhea. Amenorrhea can be physiological in the setting conditions. Physiological amenorrhea, which include menorrhea, during pregnancy, during lactation, postpartum periods, yes, and menopause. Amenorrhea causes congenital uterine absence, hormonal disturbance from hypothalamus and the pituitary glands, failure of the ovary to receive or maintain egg cells, genetic disease, causes of intersex 5-alpha reductase deficiency. Types of amenorrhea: primary and secondary. Primary amenorrhea, absence of menses by age 14 with 3 conditions unique to primary. Other causes of amenorrhea can cause either vaginal agenesis, androgen insensitivity syndrome, gonadal dyskinesis, including Turner syndrome. Primary amenorrhea is defined as the absence of menses at age 15 years in the presence of normal growth and secondary sexual characteristics. The identification of primary amenorrhea should always prompt us through evaluation to identify causes. At age 13 years, if no menses have occurred and there is complete absence of before age 15 years with amenorrhea and a cyclic pelvic pain, this girl should be evaluated for possible outflow of tract obstruction. Here I put link. You can see, you can listen lectures, doctors. Okay, next, secondary amenorrhea. Secondary amenorrhea is characterized by the disappearance of menstruation when a woman's monthly cycle has already been established earlier. It can be at any age and it negatively affects fertility. Causes of secondary amenorrhea: imbalance of hormones, gynecological disease, sometimes fibroids cause amenorrhea, psycho-emotional state of a woman, especially common causes stress, depletion of body and other factors. Classification of secondary amenorrhea. Hypergonadotrophic amenorrhea occur due to level of concentration of gonadotropic hormones that causes the pituitary gland. Hypothalamus amenorrhea This condition occurs as a result of a negative effect on the body or with damage to the central nervous system. Pituitary amenorrhea, with damage to the adrenal hypophysis or a violation of its blood supply. Ovarian amenorrhea, caused by inflammatory process in the ovaries or dysfunction of these organs. Amenorrhea of central genesis, accompanied of disturbance in the work of subcortical structures and the brain. Uterine amenorrhea canopies the effect of the uterus. Causes: vaginal genesis, androgen insensitivity syndrome, gonadal dysgenesis, including Turner syndromes. Diagnosis: how can diagnosis amenorrhea? Amenorrhea can be a sign of a complex set of hormonal problems. Finding the underlying causes can take time and may require more than one kind of testing. Which test? Pregnancy test. Pregnancy test. This will probably be first test doctor suggests to rule out or confirm a possible pregnancy. We must exclude pregnancy. Yes. Thyroid function test, measuring the amount of thyroid-stimulating hormones (TSH) in the blood can be determined if thyroid is working properly. Ovarian function test, measuring the amount of follicle-stimulating hormones in blood can determine if ovaries are working properly. Prolactin test, low levels of the hormone prolactin may be signs of pituitary gland tumor. Male hormones test. If you're experiencing increased facial hair and a lowered voice, doctor may want to check the level of male hormones in blood. Imaging test. Depending on your signs and symptoms and the results of any blood test you have had, doctor might recommend one or more imaging tests, which include ultrasound. This test uses sound waves to produce images of internal organs. If you have never had a period, doctor might suggest an ultrasound test to check for any abnormalities in your reproductive organs. Tomography, yes, computerized tomography. Scans combine many X-ray images taken from different directions to create cross-sectional views of internal structures. Computerized tomography scan can indicate whether your uterus, ovaries, and the kidneys look normal. Magnetic resonance imaging. MRI uses radio waves with a strong magnetic field to produce exceptionally detailed images of soft tissue within the body. Doctor may order an MRI to check for a pituitary tumor. Treatment. How will treatment amenorrhea? Treatment depends on the underlying causes of amenorrhea. In some cases, contraceptive pills or other hormones therapies can restart your menstrual cycle. Amenorrhea caused by thyroid or pituitary disorder may be treated with medications. If a tumor or structure blockage is causing the problem, surgery may be necessary. Diagnosis of abnormal uterine bleeding. History and physical examination. Cytological examination include biopsy and histology, pelvic ultrasound scan, endometrial biopsy, hysteroscopy, dilatation and curettage, hormonal profile, blood test, hemogram, thyroid function. Management of abnormal uterine bleeding. Treat causes appropriately may include hormonal preparations, surgery, endometrial ablation and endometrial resection, prostaglandin synthase inhibitors, levonorgestrel releasing intrauterine device. What about dysmenorrhea? Dysmenorrhea is painful menstruation is familiar to more than 50% of women. This is the name of a pathological condition when on the first day of menstruation there are strong aching or stabbing pains in the lower abdomen. Risk factors. Which factors lead to dysmenorrhea? Menstrual factors, early menorrhagia, parity lower in multiparous, diet, reduced intake of fish, eggs, and the fruits, exercise, reduced dysmenorrhea, cigarette smoking increases, psychological, emotionally dependent, and overprotected girls' family history. Classification: primary or spasmodic dysmenorrhea, essential functional, defined as painful menstruation in absence of pelvic pathology, usually starts at puberty, follows onset of ovulation and the presence throughout period of bleeding. Congestive or secondary dysmenorrhea, underlying pelvic disease, uterine abnormalities, infections, endometriosis, foreign bodies, membranosus dysmenorrhea, associated with passage of endometrial gas through and undulated cervix. Clinical features: primary dysmenorrhea, age usually seen among younger women, time 2-3 years after menarche, duration of pain starts just prior to menses, lasts about 2 days, type of pain cramping pain. Membranosus dysmenorrhea, intense cramping pain associated with passage of an endometrial gas through and undulated cervix. Dysmenorrhea clinical features: secondary dysmenorrhea, associated with specific disease and disorders, pelvic inflammatory disease, uterine fibroids, endometriosis, usually among older women, third to fourth decade. Time of onset follows initial year of normal painless cycle. Duration of pain: onset is few days prior to menses and continues throughout cycle even after uh, cessation of menses. Type of pain: continuous dual aching or dragging pain. Dysfunctional uterine bleeding. What about dysfunctional uterine bleeding? Defined as a symptom complex that includes any condition of abnormal uterine bleeding, is absence of pathologic causes. Commonly caused by anovulation as seen in polycystic ovarian disease and obesity, may occur in all age groups from prepubertal girls to menopausal women. Reasons contributing to the development of this pathology include physiological fatigue, stress, lack of vitamins, skull and brain injuries, artificial termination of pregnancy, poor nutrition, endocrine disease, inflammatory disease of the reproductive system, use of antipsychotics, neuroendocrine disease, work in hazardous production, exposure to the toxin substance, poor ecological situation, developmental disruption during the perinatal period. Dysfunctional uterine bleeding is abnormal bleeding from the uterus which divided. Types of dysfunctional uterine bleeding is juvenile bleeding during puberty, climacteric bleeding, and the stage of extinction of ovarian function, and third, bleeding of the reproductive period. What about juvenile? The juvenile form of dysfunctional uterine bleeding is caused by the immaturity of the hypothalamus during puberty. Please repeat. Is caused by the immaturity of the hypothalamus during puberty. During the reproductive period, dysfunctional uterine bleeding is usually seen during egg maturation. Dysfunctional uterine bleeding in women of climacteric age is caused by malfunctions of the hypothalamus, pituitary glands, and the ovaries, disorder of the synthesis of sex hormones, and the maturation of oocytes. During the diagnosis of juvenile dysfunctional uterine bleeding, it is necessary to exclude neoplasms of the internal genital organs, blood disease, and miscarriage. With dysfunctional uterine bleeding in women of reproductive age, it is necessary to diagnose with an ectopic pregnancy, endometrial polyps, neoplasms of internal genital organs, and incorrect installation of intrauterine contraceptives. With dysfunction of blood flow during menopause, it is necessary to exclude neoplasms of the uterus and the ovaries. Adenomyosis and endometrial polyps. Management. How we will manage dysfunctional uterine bleeding. Medical management. In steroids, we can administer antifibrinolytic agents, hormones, surgical, endometrial resections, endometrial ablation, hysterectomy. And the way to find out of having any issues with your menstrual cycle is to track periods, write down when they start and end. Also record any change to the amount of number of days bleed and whether you have spotting between periods. Any of these things can alter your menstrual cycle. The birth control pills may make your periods shorter and lighter, while on some pills you won't get a period at all. Pregnancy. Your periods should stop during pregnancy. Missed periods are one of the most obvious first signs that you're pregnant. Polycystic ovarian syndrome. This is hormonal imbalance prevents and eggs from developing normally in the ovaries. Polycystic ovarian syndrome causes irregular menstrual cycles and a missed period. Uterine fibroids. This non-cancerous growth in your uterus can make your periods longer and heavier than usual. Eating disorders, anorexia, bulimia, and other eating disorders can disrupt your menstrual cycle and make your periods stop. Here are a few signs of a problem with menstrual cycle. Have skipped periods or your periods have stopped entirely. Periods are irregular, bleed for more than 7 days. Periods are less than 24 days or more than 35 days apart. Bleed between periods heavier than spotting. Every woman's menstrual cycle is different, yes. What's normal might not be normal for someone else. It is important to get familiar with your cycle, including when you get your periods and how long they last. Be alert for any change and report them to your health care provider. Yes, how we can prevention all these previous disease. Prevention of dysfunctional uterine bleeding is essential for the transformation of this serious pathology. Monitoring the general state of the body and the immune system in childhood and adolescence is very important for the prevention of dysfunctional uterine bleeding. A refusal to terminate pregnancy and a timely treatment of acute disease of the reproductive system are of great practical importance. It is easier to monitor the state of the female reproductive system together with the doctor. Our task is not just to diagnose pathologies, but to notice changes in time in order to prevent them from degeneration into serious disease. Okay, we finished our top postmenopausal. The last, we can talk about postmenopausal bleeding. What means postmenopausal bleeding? Any vaginal bleeding in a postmenopausal woman should be considered abnormal frequently associated with malignancies of the reproductive tract. Benign causes include endometrial cervical polyps, trauma, senile vaginitis, vulvar dystrophies. Management depends on the causes. Yes. Okay, guys, we finished our topics, menstrual disorders. Thanks for your attention. I think you today understanding about menstrual disorders.